Hello and welcome to BX Clinic's first ever Facebook Live question and answer session. First of all, probably best to introduce myself. So my name's Ian Sadler. I'm a podiatrist at BX Clinic and I have special interest in heel pain. We are a clinic specialising in lower limb function, gait analysis, biomechanics, that kind of thing. And we're generally positioned for when all the things that should have helped you haven't helped you, then we're looking at what's keeping you injured or otherwise unwell. The reason behind us doing this particular event is nationally there's a campaign going on over the last 2 weeks, finishing tomorrow, called Pods Heal Heels. So hundreds of podiatrists around the country are all promoting, raising awareness of how debilitating and depressing heel pain can be. For some people, it only lasts a few weeks. For other people, it lasts months and years. So we're going to be looking at and hopefully answering some questions for people to work out what that means for them. Maybe we'll offer some solutions if you things you haven't tried before, but mainly we're here to answer questions. So for me personally, so why are you listening to me? Why am I a useful person to listen to on this? So I am let's say specialist podiatrist. I have about 24 years in medicine now. So I started as a medic with the paratroopers in the British Army. So I worked with the paratroopers and other elite and special forces for about 5 years. And then I studied podiatry, which is a degree specialising in medicine as it pertains to the lower limb. So I picked podiatry because there's loads and loads of different specialisms within it. So you can then pick all sorts of different careers, but I picked musculoskeletal or lower limb biomechanics because I happen to have a resonance for that. So I've been running private practice, only working in musculoskeletal health for now about 17 to 18 years. And I have in that time been an Army physical training instructor for the Army Reserve. So I'm used to helping people through their fitness programs and things like that, as well as hopefully fixing them when they break for that. So for a starter question, so what we're going to do, how we're going to run this. So if you have a question, we're going to be running for half an hour to an hour, depending on how many questions we get. If you would like to ask us a question, you can put it in the comments below. Alternatively, you should be able to send us a message on Facebook at the same time. So without even having to leave this app, you can come straight back and ask us a question there. So we'll be selecting questions to answer as we go. If we don't answer your question, we'll get back to you on that particular thing. If it's too specific to you as an individual, we may avoid it as a question and come back and have a bit more of a chat about it with you later as an individual. So the first place to start, it's probably sensible to start with what is plantar fasciitis. So apart from hard to spell and hard to write and very hard to say, what is plantar fasciitis? And the first thing to say is it is one of many heel pains. So there's often a conflagration where people will use plantar fasciitis as an umbrella term for lots and lots of different heel pains. So within the campaign, we use a figure of about 40 to 42 different differential diagnoses of things that are commonly misdiagnosed as plantar fasciitis. So the first key is to actually make sure that it is plantar fasciitis that you have. Lots of the conditions that we see are plantar fasciitis, but also lots of them aren't. So it's that really getting into the diagnosis and understanding, first of all, what the tissue is that's injured around your heel, so what type of heel pain you have. It's then working out how you got it, and particularly for people who come in here, why it won't go away. All right, so to start with, we're probably better to talk about what the plantar fascia is before we start talking about what plantar fasciitis is or isn't. So hopefully you can see this if I flip that over. So if I try and do my best artistic impression of a foot, so we've got a heel over here, we've got a forefoot there, we've got a big toe, and then 2, 3, 4, 5. Now this is Norfolk, so we could have a couple of extra there, and then we'll have this as the inside. So that's the medial side, so the one facing your other foot, and that's the lateral side, and then this is your heel and that's your toe. So the plantar fascia as a structure is a thick piece of connective tissue which is originating in that kind of area. It then runs up to the first toe, and then it has other slips to the other toes, all right? And in some people, it goes to the fifth toe as well. So biggest slip is going to the big toe, but then you have slips going to the others, all right? There's a broader attachment of the plantar fascia across here, and then we also have another fascia that runs on the outside. So the plantar fascia is essentially a piece of connective tissue that runs from the back of the foot to the front of the foot. So it's often described so if you Google plantar fasciitis or if you Google heel pain, unfortunately the two often come up synonymously. So plantar fasciitis is often used interchangeably with heel pain. And so the plantar fascia is often talked about as if it's a ligament or a tendon or something like that, but really it's none of those things. So the fascia is essentially, if you look at it under the microscope, it's like hundreds of layers of spider's webs that all kind of intertangle with each other. So its job is to take force or essentially strap the heel bone to the front of the foot. So it's not very elastic, but it can take tension in that direction. But it can also take tension side to side, front to back. So it's built like that to be very, very light. So if it was made of a different type of material, it would have to be very heavy in order to take that sort of tension. So as you load onto your foot goes through a movement called pronation. So it rolls in a little bit. As you accept your body weight onto your foot and ground pushes back against it, the plantar fascia stops the forefoot escaping too far away from the rear foot. So it stops the arch bones lowering too far. As you bring your heel up, it wraps around the knuckles of the digits and therefore pulls the heel bone closer to the toes. So as you go into that propulsive phase, it also then pulls the heel bone closer to it, so you get a stiffer lever to push off. So it has a springish type effect where it's taking tension and then re-delivering that back to you as an elastic force. It's kind of like a strap stopping the front, escaping too far away from the bottom, too far away from the back. All right, but it's also part of a connective tissue chain that starts all the way up in your, well, shoulders really, but then runs down the back of your leg, through your calf, through your Achilles, round the back, round the underneath, and attached into the toes. Okay, so the plantar fascia is not working in isolation. It's got a lot of things to deal with there. So if you actually do have plantar fasciitis, what you're talking about is a pain here. All right, so front inside of your heel bone. If I get the foot model again, if you come slightly forward of where the heel bone is, the pain would be here. All right. If you have pain in other parts of your foot, other parts of your heel, other parts of your Achilles, it's probably not plantar fasciitis. Okay, so plantar fasciitis is possibly implicated, so you could have damage or injury to your plantar fascia, but it may well not be in isolation. It's not going to be the only thing that's going on. So we commonly see people, like say we've seen people months and months down the line who've developed 2 or 3 different types of heel pain. It's not just the plantar fascia is injured. So plantar fasciitis, again, another reason it's a bad word. This itis that was at the end implies inflammation. All right, so you can also split plantar fasciitis down to 2 things. So you've got an acute injury to your plantar fascia, which probably does involve inflammatory process. So you've got inflammation going on. And then you've got more chronic. So if it's over about 6 weeks old, there probably isn't too much active inflammation going on in there. So it's become more of a tearing, a fraying, or a crushing of the origin of that plantar fascia. All right, so it's more of an increased load going through that fascia or being pulled up this way that's putting damage to that fascia, that then we've got to alter those loads to try and heal it. So that might be exercises, it might be insoles, it might be footwear changes. There's all sorts of different approaches to it, and really it comes down to working out what the actual problem is, rather than trying to just go plantar fasciitis has this solution. All right, so what we're going to do is hopefully I'll be able to read some of your questions on here as we go through. Perfect. All right. So I'm just being informed that this looks backwards on your view, but I'm sure you can work it out. We see there. We'll get there between us. So the next thing that we get is if it's not plantar fasciitis, what else could it be? So a very common thing that the plantar fasciitis is, yeah, thank you for that. A common thing that the plantar fasciitis is misdiagnosed as is basically a bruise under the heel. So we've got various other soft tissues under the heel which can become bruised and inflamed. So probably the most common one that we see would be an inflamed bursa just under here. So a bursa is a fluid-filled sac that's supposed to be there. So it's not something that's an injury or a problem in itself. It's supposed to be there to cushion us at that point. But if it becomes inflamed and swollen, then you're walking on a bruised thing. All right. So the easiest way to visualize it is it's a bit like a very, very deep blister. So where you get a little bubble of fluid and it's gone really deep. So it's supposed to be there acting as a cushion, and if that gets inflamed, every time you stand on it, it will hurt. Now, the obvious differential diagnosis thing there is plantar fasciitis, we are told, and if you Google it, will tell you that it's pain first thing in the morning, that as you've walked on it for a while, eases off, and then when you sit down again later in the evening, it comes back as a pain. All right. So it's that sort of pain after sitting, after resting, after sleeping, and that's sort of generally caused by the tension suddenly going through the tissue as it's been trying to heal while you've been rested. So that would be the classic thing. Now, what I learned quite early on in this line of work is almost every foot pain responds like that. When you stand on it, you either squish the fluid away, put some tension through it, warm it up, cool it down, whatever it is you're doing to that tissue, and then it feels a little bit easier as you walk. So it can be quite a misleading diagnosis, sign of the diagnosis. But if you've got the bruised thing, so policeman's heel, but it would often be called, or the general term for it. But if you type policeman's heel into Google, you get plantar fasciitis. If you type plantar fasciitis, you get policeman's heel. Those terms are used often quite interchangeably. But that would generally be pain when you first stand on it, and that would generally get worse as you use it. All right. So rather than petering off and getting easier as you use it, that would often increase because you're walking on a bruised thing. All right. So that gives us an indication of whether it's an early sign of whether it's plantar fasciitis or not. And you often find so we often find that icing will help the bruise bit, but it doesn't help plantar fasciitis. So one of the common things that we're being given you would be given as a thing to do, we sort of roll a cylinder or roll a ball or something underneath, and they'll often advise that to be cold. So if there is cool in there and it is inflamed, so if it's the chronic phase of the plantar fasciitis, or if the acute phase of plantar fasciitis, or if it's a bruised heel, that will definitely give you some relief for that sort of thing. Whereas the rolling has an effect of basically massaging the tissue and hopefully making it feel easier. So it's often a reliever rather than a fixer to roll, but it's certainly worthwhile doing as one of the things, but we've got to be aware of what we're trying to achieve with it. So just seeing what questions we've got. So first question we've got is about stretching. So commonly, something that's being given for plantar fasciitis is stretching your calf muscles. So the Achilles, so they've got the calf muscles up here coming together to form the Achilles tendon, attaching into the back of the heel, but really being pretty continuous under here, and then you've got the plantar fascia, so the tissue under here. So as we apply a force this way with your body, so imagine your body at the top swinging over, so as we apply that force to the foot cannot give way, because the foot cannot go any further down because the ground's in the way. So there has to be a stretching going on here. So that's actually obviously very useful and very normal to get, and it's all part of the system about how it's supposed to function. But if your calf muscles are particularly tight, you are then limited in doing this particular movement. All right, but it could be not just the calf muscles. If your hip flexors are also tight, you can't get past your foot, so your foot's on the ground. I don't know if you can see my foot from there, but if your foot's on the ground and you're trying to swing your body weight past it, you need to be able to extend the hip and get stretched through the Achilles. So if you're lacking in one of those two places, it will force the foot to try and flatten further. All right, so your foot the plantar fascia will then have to resist that strain caused by your body weight swinging over the top with tight bits. So that's why calf stretches are commonly given, all right, because if you can loosen that bit off, then you put less stress on the plantar fascia, which then hopefully allows it to heal. So it's not exactly fixing it or curing it in itself, it's not a healing agent, but by taking the tension out of this bit, you take the tension, you put less tension on the foot because the foot has to press against the ground, whatever you do, all right? So calf stretching, so the question was specifically, could calf stretching cause your plantar fascia to become inflamed or injured? And it's certainly a possibility. I don't think it's a common thing we see. And if it was, it would probably be more the acute sort. You'd probably hurt it. And if you didn't keep doing that particular problem, that noxious stimulus, then it would probably get a little bit easier over time. So a plantar fascia, or any form of heel pain really, should be getting better. You should notice it getting better in about 4 to 6 weeks' time if you don't keep doing the thing that injured it. So to give my personal example of plantar heel pain I had, I went to a running club that took us off-road on very boggy ground when we should have been going on a road to run. So I had my very soft trainers on rather than my more soft trainers on rather than my off-roady ones. And my plantar fascia got strained sort of left to right. So I've got a bit of a stiff foot. So I was rotating around it quite a lot, which put quite a lot more tension on than it could cope with. So by not continuing to run in that way, by removing those trainers for a little while, and by basically resting it and doing some strengthening for it. So we'll talk about strengthening again in a minute if we wish. So doing some strengthening for it, I didn't get that back. All right, so that was a one-off instance that caused an injury. Whereas for a lot of the people that come to us, the pain keeps coming back. It won't go away. It started in both feet, and then now they've only got it in the left one. So we're trying to sort of piece together why those sorts of things occur. But hopefully that answered the question about stretching. So we've got, excellent, got names now. So Rachel has asked, had plantar fasciitis for a few months, got osteoarthritis in my big toe on the same foot. Could there be a link? So it's not uncommon, and particularly for the big toe to not be able to bend because there's a bit of wear and tear in there, and it's actually quite a common thing that we would see. Now, if we think about the function of the plantar fascia, in order to give you that spring, if you like, and stiffen your foot as you go into the propulsive phase or the toe bending phase, you've got to be able to tighten that tissue around. So it will certainly compromise the function of your plantar fascia if you've got something with your big toe. So whether that be a bunion or whether that be a bit of arthritic change, something that limits you in the ability to bend through that big toe will alter the requirement that you have for that plantar fascia. All right, so you can potentially strengthen around it or employ other cheats, but often we would see people, so if your big toe won't bend, one thing you could do would be to go round it. All right, one thing you could do would be to lift up earlier. One thing you could do would be to basically roll around the inside. So you would find a way to get past that blockage, and some of those things may put extra strain on your plantar fascia. So if you imagine that as you're propelling off, you start swinging the foot round that way, then the plantar fascia is now suddenly having to go that rotation force rather than a linear force that it was has been trained and designed for. So that as a particular condition, if it is implicated, then really my only solution for that in the long term is probably insoles. So we need to re-engineer the front of your foot so that your foot thought it was bending properly. All right, so that's nothing to do with arch support, nothing to do with anything else, but we would use insoles to basically dig out space so that it felt like your foot was basically going through that full range of movement, which then hopefully put the appropriate forces back on. Now, in that case, the orthotic insole would probably be a permanent solution, but if it's for lots of other things, an orthotic insole, so a device you put in your shoe to change the way your foot touches the ground, can be a temporary thing, so part of a rehab, for example. So again, hopefully that answers the question for you there, Rachel. So the next question we have on there is, so if a lot of people will start off with a type of heel pain and get it on both feet. So I'm going to use an example to answer this question. So basically the question is, why do I get it on one foot and not the other? All right. So we've got an example of a lady that we've seen quite recently who's got she started off with heel pain on both feet, and it appeared to come on because she'd done a lot of off-road walking that she wasn't used to. Then when we looked at, she came to us several months later because it had gone in her right foot, I think it was, but she still had it in her left. When we looked, her hips were not functioning in the way that they're not symmetrical in their function, which meant that she'd been putting a bit more strain on that left foot than she had on the right. Now that had always, well, certainly for a long period of time, that walk on the off-road hadn't caused that problem, but it made her more reliant on the plantar fascia and the tissue around the inside of the ankle to resist what her hip couldn't do. So that meant that once it was injured, it wouldn't really get better. All right. Whereas it wouldn't have got that hip issue probably wouldn't have caused a plantar fascial problem in itself, but once it had occurred, she couldn't get better from it. So that's one common reason that people might find that they get pain on one side and not on the other, because if there's something else going on that's keeping it injured. All right. So the sorts of things that will often Dr. Google, the advice you get with the advice slips that you can download, or often the GP will give you, say things like rest it, ice it, stretch your calf muscles, roll a cylinder underneath it, maybe use some anti-inflammatory creams, that sort of thing. For most people who suffer a heel pain, that will probably get rid of it. All right. For the vast majority of people who have the heel pains, I don't have statistics on it, but would be an injury to the heel in some way. So maybe the Achilles, maybe the bursa underneath, maybe one of the tendons around the side of the ankle, and that would make it sort of go away in that sort of time frame, so 6 weeks or so. If you're not seeing the benefit of the treatment in the 6 weeks, then the likelihood is something is going on that's keeping that tissue injured. Now, whether it's that you keep putting the same noxious stimulus on it, so again, another chap we had recently changed his running style, which put more stress on his ankle and therefore hurt his plantar fascia. Now, it doesn't mean it's the wrong running style, but he needs time to get used to it. All right, we perhaps be using things in the short term to enable him to sort of change to there. All right, but so if he continued to do that running style, then that would be the noxious stimulus that just wouldn't go away. Okay, so other things which are commonly misdiagnosed as plantar fasciitis. So we've talked about the two most common ones, which are acute and chronic strain and injury to the plantar fascia itself, and bruising to the tissue under here. Now, another thing that you may get to the bruising under here is we've got a very clever fat pad that sits underneath our heel. It's if you imagine, it's not exactly this, but if you imagine little hexagons of fat with very thick walls that mean that when you land on it, they sort of compress, but then they don't lose their shape. They come back very quickly. Now, that's impregnated with lots and lots of little micro blood vessels, which mean that when you land and you squish that away, by the time you've lifted your heel up and swung it to land again, then that's refilled with blood. So you essentially get a new heel cushion to stand on every step. Now, when it's working efficiently and well. You'll probably have experienced it not working as efficiently as well. So if you've had to stand for a very long period of time quite still, so if you've worked on a trade stand, or if you've been a security guard or something like that, then you may have had to stand for a very long period of time, and you will often find that your heels and the ball of your feet start to ache because what you've done is squished that padding away. You've not allowed it to refill with blood very easily. So what happens there is you're then having to take the load directly onto the bone and that sort of cushion. So if the fat pad is not working very well, then that can make you more prone to getting heel pain type conditions. And unfortunately, that's one of the only things that does appear to be aging related. So lots of things that people come to our clinic with are more knocks along the way. So rather than aging, it's that you've picked this up, you've been coping with that, you've been treating this for years, but it's now not managing to be treated, and those sort of things. So those sort of knocks along the way are quite common, rather than it being purely an aging process. Whereas everybody seems to lose the return of that fat pad, so it gets more. So when you squish it, it doesn't return very quickly to its original shape. So that does appear to happen to everybody as they get older, but it's not uniform. It's not you reach 65 and it's a problem. I see 35, 40-year-olds with it as a problem, and I see people in their 80s that it's fine. All right, so it does appear to happen with time, but that doesn't necessarily cause your heel pain, but it would make you vulnerable to something that you weren't vulnerable to before. All right, now if we come to the treatment for that, the logical treatment would be something like a bit more cushioning under the heel. So gel pads can be useful for it, but generally would suggest you could try to get it from the footwear rather than adding pads and things like that to it. However, the problem is if you've thought that you've got a bruised heel, but what you've actually got is plantar fasciitis, if you stick something really cushiony under it and it wobbles you around more, that could in fact put more strain on the plantar fascia. So cushioning, although intuitively most people's first instinct when you've got a heel pain, of course it hurts when you stand on it, so the logic would be that it requires a bit more cushioning. But if you've actually got a strain to your plantar fascia, standing on something that's more wobbly and unstable could actually increase the discomfort and the stress and the strain to that tissue. So it's not uncommon to see people cushion their heel, and then when that doesn't work, put more cushion on it. And when that doesn't work, put more cushion on it. So you see people with very cushioned shoes with gel pads in there, plus cushiony socks and things like that. And unfortunately, that in that particular instance, it's actually a catalyst. It's making it worse rather than making it better, although you're intuitively doing the right thing. All right. So again, another thing to perhaps say about the sort of people that we tend to see, they're generally the outliers. Yeah, if the normal things that should have worked were going to work for you, then you would never come and see us. We're there really for when all the things that should have worked haven't worked, and then you come and hopefully we try and work out what that is with you. Got a question from Paul. He's been doing some home fitness during lockdown, pain in the back of his heel to the left. Could this be plantar fasciitis or the bruising? I think probably, obviously I can't answer that specifically for you, Paul, but generally we are seeing quite a lot of people suffering these sorts of heel pain, connective tissue problems as a result of changing their habit. So if you're not used to doing home workouts, or you'd usually go to the gym and you've had to use just the equipment you've got, or you've not done any running, but running is now a thing because lockdown allowed you the time to do it. Equally, a lot of people have gone out and done lots of walking that is not necessarily useful, not very useful, very useful walking, not something they're used to doing. So that increased stress onto something that has not been designed for it. Now, I don't mean it's not designed as in anatomically, biologically designed, but you have to build up to it. All right, it takes time to lay down thicker tissue or stronger tissue and things like that. So you've got to build up to it. And I think for a lot of us, it's been quite a sudden change. We've gone from maybe sitting at a desk for 8 hours and not really moving much at all, to going for an hour's walk at lunchtime. Now, as an hour's walk should be fine, but for some people, that immediate change is more than the tissue can cope with. So that's quite a common sort of thing. Let me just refer back to that message again because it's had a bit more specific. So pain on the back of the heel to the left, could this be plantar fasciitis or bruising? So again, this is where it gets a little bit tricky. If we mean to the back of the heel, and if it's to the left of a left foot, then it could be strained to this other type of, so it would be a plantar fasciitis, but it wouldn't be the classic one. So you could get strain there. We've also got laying underneath that fascia. So if you think that fascia is the most superficial, the most surface tissue underneath your skin, under there you've got muscles, under there you've got tendons. So we see quite a lot of people who have pulled a tendon in their foot or overstrained a muscle. So if the pain is in the middle of your arch sort of area, it's more likely to be a muscular sort of pain. If the pain is in a different area of your heel bone than this sort of medial, sort of just in front of the heel bone there, then it's more likely to be a tendon. It doesn't mean it's not plantar fasciitis, and it doesn't mean the fascia is not involved, but it's more likely to be one of those other things. So we would then be asking you lots of questions to try and work out when it's hurting you, how it's hurting you, does it go anywhere else, can we repeat it with certain actions? So I think with the very limited history we've got there, it sounds, Paul, like it might be more of a muscle or tendon strain than certainly a traditional plantar fasciitis. So next one from Louise: how effective are steroid injections? Had for a year. Okay, so I'm not sure what the had for the year is, but steroid injections are one of the first line that the health service will use often for plantar fascia or plantar heel pain. So if we get away from calling it plantar fasciitis and call it plantar heel pain, if you've got a pain under your heel, lots of them might be inflammatory. So plantar fasciitis as a condition is as the strain, the crushing, the tearing, the fraying sort of that you're getting at the origin of the plantar fascia here is, in my experience, not that responsive to a steroid injection. Now, if you've had it, if it's brand new, so let's say you're a professional footballer and you've just done it and you need to play football on Saturday, then putting a steroid in will probably make you able to play on Saturday. Now, if you then come away from the plantar fascia as a problem and a lot of the other swelling sort of things that could be around the heel, so whether that's a tendon, whether that's a muscle, whether that's the bursa under there, if you have a steroid injection and that's your main problem, then that would probably be quite helpful. So a steroid is essentially a big bolus of anti-inflammatory. So it can basically just hopefully knock out the inflammatory process there. Now again, if your problem is that you jumped off a wall, really hurt your foot, bruised a thing, got a tendon strained, all those sort of things, but you're not going to keep jumping off the wall, having a steroid injection can be quite useful. If we use another scenario that we talked about earlier, if it's that your hips changed its function and then you keep putting the strain on that heel that it can't cope with, then the steroid injection will be a stopgap, but the pain will probably come back because you've not got rid of the mechanical underlying problem that's going on. So they certainly have their place. We don't not refer people for steroid injections, but and a lot of people have tried them by the time they come here. So yeah, they're not useful, but I think you've got to try and work out what the actual heel pain is rather than just go heel pain steroid injection, because then it's kind of an open question as to whether it's going to work or not. So I've certainly had people who it worked on their left foot and not their right one because they had strained their plantar fascia, so therefore couldn't weight bear quite as well on that foot, so landed more heavily on the other one, therefore bruising that heel. So they've got two different heel pains, but both would be classified as plantar fasciitis. Had a steroid injection, worked on one foot and not the other. So I think that, yeah, they definitely have a place on there, but probably we need to work out whether it's going to work for you or not and be the right thing. So the next question we've got is from a yoga studio, and it's is strengthening better or rest better? So again, it's whether we're looking, if you've just injured it and it's caused by a particular activity and we can link it to that, then resting from that activity for a while but doing things similar to that activity but to a lower intensity might be quite a good way of helping that particular thing. So to give it its medical terminology, rehab. So but when we're talking about strengthening, now strengthening is often part of our treatment plan. All right, so we're looking to make the tissue and your body able to cope with the thing that you want to do. So if you've taken up running in lockdown and you want to carry it on, then your body may need a bit of extra preparation for that than just putting on a pair of trainers and going for it. So you can't really strengthen the fascia, all right? So not in the true sense. So strength really means, can I apply contractile force? And really, how powerful is that contractile force? So will the muscle do the job? And because the fascia is not a muscle and has no contractile force, it's basically a strap, if you like, in that way. It can resist lengthening by taking tension, but it can't actually contract against that contention. So you can't really make your plantar fascia stronger. What you can do is make it thicker. So if you exercise, do specific exercises for it, and a lot of the things that you may have seen on Google and that sort of stuff, if you've looked at the rehab programs that are out there for plantar fasciitis, if you put load on it over time, then you grow thicker fibers or more densely packed fibers, and therefore you've made the fascia more resilient to that particular problem. What you can strengthen is the tissue around it. So, for example, we have a tendon that comes around, a muscle turning into a tendon that comes around the inside of the ankle here, and its job is to limit that rotation inwards, that pronation movement. All right. Now, pronation is not bad or good, it's just what you do. All right, so you don't suffer with pronation. Pronation is not a problem. It's just a movement, and for some people that movement hurts them. Some people it doesn't. Some people it's a get out of jail free card for when something else isn't working. So pronation as a movement is fine. We're not worried about that as an actual thing. All right, but you do have to control it. So you've got a muscle here, posterior tibial muscle and then tendon coming around, and its job is to decelerate that roll in. So if that muscle is not strong enough for what you're trying to do with it, then your foot will flatten harder. So we might look to strengthen surrounding tissue to take stress off the fascia. Okay, so we might be looking to do those sorts of things. Equally, the muscles that run underneath the foot, we can get them, we might look to make those a bit stronger to be able to deal with it. But strength in of itself is not always good. All right, sometimes things can be too strong. All right, because you're cheating with it. You don't spontaneously get a strong muscle. You've got to lift a weight or do an activity or something. So we'll be looking at more balance and whether that's working for you between the way the muscles are working rather than just blindly strengthening everything around it. So we try and very individualize the approach because the generic stuff would have already worked for you by the time you sort of see us, I would suggest. So the next question, which came through on a message to us, so someone who'd like to remain anonymous by the sounds of it, is can you run on your plantar fasciitis? All right, so if you've got heel pain, can you run on it? So the first thing you'd want to know is what is the heel pain? I'm afraid it's not just a blank check of going yes or no, you can run on it. So the first thing we want to know is it likely to be making your problem worse to run on it? All right, so in our rehab, in getting people well from plantar heel pains, we would often get people running, but within their capacity. We tend to, and I'm as bad as everybody else, we want to run at our capacity. We always want to push our capacity. You always want to beat your last park run time. But we may get people to run within their capacity so that they're putting stress through the tissue, but not so much that it hurts it. All right. Now that's different to pain. Sometimes it will still be painful, but not be making it worse. All right, so I'm afraid it's not a blank check. Yes, you can run. No, you can't run with it. It really is trying to understand what the problem is and how we can perhaps work around it. So thinking of someone, again, another patient we've had, fractured ankle, had all sorts of pins and things put in there so the ankle just doesn't bend. They get strained to their plantar fascia because their ankle just won't do it. No amount of stretches is going to do that. Strengthening will help resist it. So you can help the resilience to that broken ankle, but we can't change the broken ankle. We can't unfuse it. So in that case, we're going to use shoes, insoles, things like that in a way to help it. We're also perhaps going to look at running style and running cadence and that sort of thing to see if we can put stress on other bits rather than the ankle and the heel, but then we have to make those other bits resilient to that stress that you're getting as well. So what we don't want to do is sort one problem out and send it somewhere else. So I'm afraid to whoever it was who sent that question, it's not a blank check of yes or no. I'm afraid it's not quite as binary as that. What we want to do, because a lot of the time pain is not very analog to how injured the thing is. Some of us will get more pain stimulus or less pain stimulus. What we really want to know is it likely to injure it further to do that sort of running activity? All right, so yeah, hopefully that's answered the question, but probably not the answer you were hoping for. But if it's reassuring, very seldom do we tell people not to run. All right, often it's modifying it, changing it in terms of intensity, speed, duration, those sorts of things. So next question we have is, do we recommend night splints or compression socks? So a compression sock is, again, I would suggest mainly going to be a reliever. So if you've got swelling and tension in your foot and you put compression on it, usually that feels fairly nice. I'm not sure that actually does anything to heal it in the long run, but if you're one of the people who are only going to get it for 6 to 8, 10 weeks sort of time frame, now when I said 6 weeks, you can probably double it for feet because you keep walking on them, all right? But you should be noticing it getting better within 6 weeks or so. If it's not getting better, then we probably need to think about doing something to aid it. But compression sock is probably going to make it feel easier while it's getting better, but it's probably not going to actually fix it. So what a night splint is some form of sock that you wear at night, as the name implies, that puts a stretch and pulls the top of the foot towards the shin bone in some way. All right. Now, often most of us sleep in some sort of position that lengthens our foot. So in doing so, it shortens the distance between the heel and the toes. So when you heel it overnight, which is when you're doing a lot of your musculoskeletal healing, it's probably healing short. So when you stand on it first thing in the morning and you put that stretch through it, it kills you. All right, those first 10, 15, 20 steps, half an hour maybe, that's really excruciating with plantar heel pains. That's perhaps why we get some of those sorts of pains. So what a night splint is thinking it's going to do is basically put a stretch through the plantar tissue and a stretch down the Achilles while you're sleeping. All right, and hopefully it maybe makes it feel a little bit easier. They went out of vogue because people didn't really sleep in them. All right, they are annoying to sleep in. They're warm to sleep in, depending on, some of them are quite bulky. If someone's in there with you, they may not like getting kicked with it halfway through the night. So they went out of vogue a little bit. We do use them in some cases, particularly if we've got someone who's only injured it and they're probably going to get better from it. So our heel pain kit. So we've got a simple thing on our website where you can just answer a few questions and it will try and work out whether you should be able to tell you whether you've got plantar fasciitis or not just by answering those questions. And then it will recommend whether our heel pain kit is useful for you or not. So that's basically, it includes a night sock, it includes some cream to make it feel a little bit better, and some strengthening and stretching exercises, which for 80% of people should be enough. All right. So just doing those sorts of simple exercises and the recommendations on there, you should be able to get that. So I think we can probably put the link to that sort of questionnaire in the chat here, and then just go to our website. If you're not sure if you have plantar fasciitis or not, then answer those questions, and if it's useful, then you can get a heel pain kit to that I've put together to hopefully help for those people who've got the short-term plantar fasciitis, because hopefully you never need to come in and see us at that point. But yeah, night splints I think are quite useful. Where I tend to recommend people using them is, rather than trying to sleep in them, if you do get a couple of hours off in the evening to watch some TV or read a book or something, then wearing it on the sofa will put that stretch through it without you having to remember to stretch. So that's probably where they've got use. Some people can sleep in them. Some people are happy to sleep in them for some of the night and then take them off. But yeah, that's sort of what we think they're achieving with those. So next one, again, coming through as a private message, will trainers help? So can I buy a pair of trainers to make it better? Yes, trainers will help if trainers were the problem. So if you think that your footwear was the causative factor, then changing that could be a beneficial factor. So it's not that there is a plantar fascial trainer, it's not that there is even a plantar fascia shoe. There is no one shoe that's good for plantar fasciitis or heel pain. There's no one insole that's good for it. There's no one trainer that's good for it. But there will be one that's probably better or worse for you as an individual for benefiting that. So you can't, it's difficult to go on a forum and say what's a good trainer for my heel pain, because a lot of them will have worked for that person but won't necessarily work for you. So what you can do is change the stress. So if you have plantar fasciitis currently and running in this pair of trainers, which was fine before you got the heel pain and now isn't fine, if you get a different pair of trainers, it will probably put a slightly different stress on your foot. So it might make it a bit easier to run on it, but I'd probably say you can't chuck money at the situation and just buy a pair of trainers which are good for plantar fascia problems or heel pain problems and things like that. You, again, really need to know what the actual tissue is that's injured and work out whether you need something that's cushioned or firmer or has a rock on it or a steeper heel cup, or, you know, there's all sorts of different features that aren't how they sell you trainers, which may or may not be useful. So some of them will have a bigger sort of flare on the back of the heel, and that would be useful for some people, but actually quite irritating for others. So it's for working out what features there are there. And again, we've put together what we call a trainer recipe. So we can't prescribe you a pair of trainers because There's so many variants out there, and if you buy a pair of trainers that's 6 months old, it's a different one to the new one. There's slightly different features and things in there. So what we do is we basically say this would be a good feature, this would be a good feature, this would be a good feature. Now try and find a pair of trainers that fit you and are comfortable, and have as many of those features as possible, because that should be the best sort of combination of things. There's no panacea when it comes to trainers, but lots of the people who've come to see us have actually tried 2 or 3 pairs of trainers in the meantime, and I think, being a runner myself, it's more attractive to buy trainers and hope that that's going to sort the problem out, than it is to seek a medical consult to try and work out what it is. We like buying trainers. We don't like admitting that we might have a mechanical fault or something with the way our body's working. So yeah, hopefully that answers the question for you there. Again, slightly nuanced. So yeah, next question, is plantar fasciitis the same as policeman's heel? If you type it into Google, yes. For me as a diagnosis, no. So policeman's heel is that swollen bursa more directly under the heel. Plantar fasciitis is a strain or a tearing or a tugging to the actual fascia itself. So for me, they're different conditions, different treatments, different types of tissue that are injured. But if you type it into Google, most of the things that come up will conflate the two together as heel pain. So this is where it's quite difficult, because you'll get people very firmly telling you that this is the answer to plantar fasciitis, but what they've actually fixed is their policeman's heel, or their tendonitis, or their Achilles problem, or their bruised bone, or something like that, which was given the umbrella term plantar fasciitis rather than being a plantar heel pain itself. Okay, so short answer, no, they're different things, but they don't often get treated as such. So I think that's it for questions that have come through on here. So I don't know if we've got any more. So if you've got any last questions, we've been going for about 45 minutes now, so well done for still being here. So if you've got any questions for us, just put them in the chat or send us a message now, and I'll pad for a couple of minutes to give you a chance to do that. But hopefully this has been a useful sort of talk through answering hopefully a few of your questions about what plantar heel pain is, and that's before we even get to the fact that a lot of Achilles problems get diagnosed. So the Achilles being the structure that comes into the top of the heel, we see lots of people who've been told they've got plantar fasciitis, so a plantar being the bottom of the foot problem, because their Achilles hurts. And it often comes from, I think, the fact that those Achilles problems will also hurt you first thing in the morning when you walk on them, ease off a little bit as you walked on them for longer, and then come back and get you later in the day, which we're told is the definitive answer for plantar, or a definitive story for plantar fasciitis, when actually lots and lots of different heel pains and lots of actual foot and ankle pains will respond in that sort of worse as the day worse first thing in the morning or after rest, and then ease off a little bit as you've been through. So if we haven't had a chance to answer your questions that have come through, we'll go through those later on, and if they're more specific individual questions, we might have to contact you to sort of ask you a few more questions rather than be able to answer it from a quiz of this sort. But if we haven't answered any of the questions which are easier to or more straightforward to answer, we'll get back to you either today or early next week. As we go through this, go through the message and the chats that have come through with it. So if you need us for anything, then obviously you've got our Facebook here, so please like that. Instagram, I'm Ian_Sadler_BX. So BX is my medical shorthand, or the medical shorthand for biomechanics. So hopefully you can find us on there on the Instagram. But we also have a clinic page, which is just BX Clinic. I think we're the only BX Clinic on there, so hopefully that's easy to find for Instagram. But there are our main two channels of Facebook and Instagram. We put updates on there quite a lot. If you are a professional watching this, so a physio, osteopath, chiropractic, other podiatrist, whatever, then we do run training courses as well. So if you're interested in that, if you go to BX Clinic, the website /learn, so bxclinic.co.uk /learn, there is a sign up form there, so you can get on our mailing list, and we'll tell you about educational opportunities and stuff coming up there. So I'll just have a little look and see if there are any more questions coming through. So I've got two more questions. So would an MRI show up? So basically, so an MRI is often the best or the most definitive tool, but it's not always. So usually a radiographer hopefully will be the final person that tells you which type of scan to have, because different tissues, different types of things show up differently on different scans. So sometimes and often an MRI is the best thing, but sometimes you might be better to have one of the other type scans, ultrasounds, that sort of thing. And certainly you can tell a lot from those, and they're less expensive. But we tend to refer to radiographers to make those sorts of choices for us as to what we say what we think it is, and they then pick the one to do it. So what an MRI will do is tell us. So if all the clinical, where we often use them, is if all the clinical things all the things I can test for and we can talk about and get to are pointing to one thing, but you're not responding to that as a plan, then we can take an MRI and see if there's something else going on that we can't find out in our clinical tests, and equally we might occasionally use it to confirm a clinical test. So they certainly have use. But going back to our runner analogy of saying, does running make it worse, or can I run on my heel pain? If you know that the tissue is damaged in this way and it's not getting worse because you're running on it, then that gives us that answer, because pain is there to tell you there's a problem. But if you already know what the problem is and you've got that defined and you know how bad it is, then pain is just reminding you it's there. So that's a bit of a jump mentally to do. But so MRIs can be very useful. They're not rare to do, and hopefully they'll give you more answers, but they would usually be, from my protocols, if all the things that should have worked again haven't worked, then we might have to get a bit more information about what's going on in there. So last question was a bit in the vein of is policeman's heel the same as plantar fasciitis? Is a heel spur the same as plantar fasciitis? So the heel spur is essentially if you take an X-ray or some other scan of the foot, and you see what looks like a shark's tooth coming out of the place where you normally get the plantar fascial pain. So the assumption is then that that's the thing giving you the plantar fasciitis. And this is one of the problems with scans and things like MRIs and stuff, is sometimes they give you more information and confuse the picture a little bit. So most of the time, relying on people who do the dissections and studies of this sort of thing rather than something I see in the clinic, but most of the time those spurs are not actually on the plantar fascia. They're within the tendon of the structures that lay deep to the plantar fascia. So if you think of the fascia as this sort of sheet over the top of it, and then you've got layers of muscles and tendons deeper, you've got tendons attaching into the same sort of place. So the heel spur is often into the tendon of one of the muscles of the foot rather than in the fascia itself. Now, the statistics tell us that if you x-ray 100 feet, lots of them will have a heel spur and no pain. Lots of them will have pain and no heel spur, and lots of them will have pain and a heel spur. So it's correlative to heel pain, and it's certainly a sign that you've been taking pressure or strain or something in that heel more than the bone's attachment to the structure can cope with. So you've pulled hard and your body's gone, right, I need to build more bone to hold on to this tension, this tugging. So heel spurs are a sign that you're definitely working that area harder, but whether they are the problem seems to be correlative rather than causative. However, if your fat pad then gets thinner, then a shark's tooth of bone sticking out of your heel becomes a problem. All right. If it irritates and presses on a nerve, so if it pokes out in a point where it's just touching on a nerve or irritating the plantar fascia, then it can become a problem. But often it's not necessarily the cause of plantar fasciitis in of itself. All right. So correlative probably rather than causative, but certainly it can become problematic. But then it probably isn't plantar fasciitis. So I think we'll round up there because that's pretty much an hour we've done. So hopefully, if I've got this right, it's the first time we've tried to do one of these lives into our group, or into our page. But hopefully, what's going to happen is this live will now exist as a post within the group, so you can go back and watch it if you missed anything or I was rambling. But otherwise, it's just for me to thank you for your time today and your interest. Hopefully we answered some of your questions and we didn't ramble on too much. If you've got anything more specific about yourself, then please do feel free to contact us. If you've got any suggestions for other events that we might do in the future, again, let us know. Otherwise, I hope to see you soon, and thanks very much.